A note before we get started. This episode includes discussions of suicide. If you or someone you know may be considering suicide, contact the 988 Suicide and Crisis Lifeline by calling or texting 988. It's a cool, clear morning in Los Angeles, middle of October, with a view of the Hollywood sign. A handful of open-air tents and hodgepodge structures dot the sidewalk. It's messy. An office chair, bags, a bicycle, food containers, more bags. A city worker in his tractor scoops it all up, dropping it into a teal garbage truck. Until this morning, people lived in those tents, and that was their stuff. A Supreme Court decision in 2024 gave cities the green light to forcibly remove people from the streets, even if there was no shelter or housing available. That was welcome news to many elected officials and residents who have become increasingly frustrated by the growing number of people living outside.
City and state leaders say they are fed up with the growing homeless encampments.
My child is 7, and she thinks she's picking up Lego pieces. And it's not Lego pieces, it's needles.
I've talked to a lot of the residents in the area. They've given up on this park years ago.
I think we need to get a handle on this issue before it gets any worse in the city.
But evidence suggests that so-called encampment sweeps can be harmful to people's health.
We're looking at substantial numbers of deaths.
Today, we dig into the health consequences of forcing people to leave their homes on the streets and how cities can minimize those risks while still clearing encampments. From the studio at the Leonard Davis Institute at the University of Pennsylvania, I'm Dan Gorenstein. This is Tradeoffs. Jazmine Mapes has been homeless off and on for most of her adult life. The 31-year-old says sweeps are just part of living in tents and riverbeds in LA. Cops, sanitation workers constantly telling her, "Come on, time to go. You gotta leave."
A lot of times I would lose everything. I mean, everything.
Her sleeping bag, her medications for anxiety and depression. One time, she lost a photo album with pictures of her 4 kids she'd given up for adoption. It still tears at her.
I remember trying to run back to the tent and telling them, please let me just grab just that. Nothing else. I won't grab anything. Please just let me grab that. No, if you grab it, you will be arrested.
Sometimes these sweeps came with offers of shelter or treatment for her addiction to crystal meth. Those were the exceptions. Often, she says, the sweeps basically blew up whatever stability she'd managed to scrape together.
You know how they say, oh, you take 5 steps forward and you get knocked 10 steps back? That's how I felt all the time.
Maybe one of her lowest moments came on a cold, wet November morning in 2023. She'd been up for hours. Her ex-boyfriend had burned down her tent in the middle of the night.
My hands were completely black. I was covered in ashes and dirt.
Now, all around her, cleanup crews barked at people to leave the encampment across the street from City Hall.
That's all trash. Just leave it there.
Jazmine asked one of the sweepers to pour water over her hands.
I remember the person just looking at me, and they looked away and walked away.
Jazmine had learned over the years that these sweeps destabilized her, could push her deeper into depression, deeper into drugs. She started to feel herself spiral. She'd lost her tent, now the sweep. She says a cop at some point grabbed her arm, pulled her across the street.
I didn't feel like a human. It felt like, how much lower could I get?
Jazmine wandered to a nearby bathroom to regroup, to clean herself up.
I went into one of the stalls, and as I'm digging through my purse looking for soap and like shampoo and stuff, I found a bottle of pills. I'm thinking to myself, I'm done. I'm done with everybody judging me. I'm done with fighting against the world, myself. I'm tired of fighting my addiction. I'm tired of missing my kids. And I swallowed just about the entire bottle of pills.
Josh Barocas has met a lot of people like Jazmine. He's treated them as an infectious disease doctor at the University of Colorado. He's interviewed them as a researcher. Josh says as cities started ramping up sweeps 6 or 7 years ago, he felt a growing urgency to answer a simple question.
Is it harmful to people's health to be forcibly displaced?
The question, though, is more tricky than it may seem at first. On one hand, there's comfort and safety to having a predictable place to live, even if it's a tent. Losing that tent along with your wheelchair or medication can be harmful. It can also mean losing touch with medical providers like street medicine teams. On the other hand, though, leaving encampments in place means allowing people to live in what are often unsanitary, dangerous conditions.
There are a lot of well-meaning city officials who think getting people out of the elements is going to definitely be better than letting people stay outside. And they think sweeps are a good way to do that.
About 5 years ago, small studies started coming out showing that sweeping people can harm their health. But Josh says city officials often dismissed that research as too narrow or too city-specific. So Josh and several co-authors took the results of a few of those studies from Denver, Los Angeles, and San Francisco, along with more general data on homeless people from 23 other cities. They put all of that information into a computer model to estimate the impact of sweeps nationwide. The team then compared what happens to people's health if they're allowed to stay in their encampment versus being forced to move on without any offer of a place to stay.
Sometimes we have small little findings. This was unambiguous.
The researchers found that the sweeps increased people's risk of infection, hospitalization, overdose, and death.
We modeled thousands and thousands of different scenarios, and under no circumstance did sweeps improve health, and in fact, under no circumstance was their effect even neutral.
The study was published in the journal JAMA in 2023. Immediately, some advocates and researchers ran with it. They said it proved how harmful it is to clear out homeless camps this way. Josh said some mayors called the results misleading because the researchers assumed that people are not offered services as part of the clearings. There's limited data on how often sweeps come with such offers, but in the 18 months since the Supreme Court allowed communities to remove encampments without offering people a place to go, more than 200 cities have outlawed sleeping outside.
Our study was meant to look at what is, I think, the most prevalent practice in the United States, which is just moving people, getting rid of their tent without any additional services.
Josh is quick to agree. The study has limitations. Getting a definitive answer, he says, on the harms of sweeps is hard. But to him, the work clearly shows that the threat to some people's health is real, adding evidence to a tricky policy question that carries serious stakes.
We're not trying to tell you that it's going to add 3 more deaths or going to decrease risk by 12.2572%. We're just trying to give you a sense of what might work and what might not work. And if you continue going down the path of sweeps, then it looks like we're going to cause more harm to people than if you were to go down a different road.
So, what does that different road look like? Allowing encampments to exist carries its own risks. Can cities address concerns about people living on the street while avoiding the harms of the sweeps? More on that and what happened to Jazmine Mapes when we come back. Welcome back. I'm joined now by Tradeoffs managing editor Ryan Levy. Hey, Ryan.
Hey there, Dan.
In the first half of the show, we talked about some of the health harms that can come with sweeps, the distress it can cause people like Jazmine Mapes, and the evidence that it can lead to increased risks of infection, hospitalization, overdoses, and deaths. Some cities around the country are trying to figure out how to minimize the harms and still clear these encampments. Ryan, you've been talking to folks about how to best thread the needle for the last few months. What have you learned?
Basically, I wanted to find out if there's such a thing as a good sweep. There's very little research on this question, but I did come across a handful of so-called best practice guides. One of them was co-authored by Marc, who's at the Benioff Homelessness and Housing Initiative at the University of California, San Francisco.
We should resolve encampments, and the word resolution here is the idea that you resolve a person's episode of homelessness.
Marc told me they developed this guide after running a homeless program in King County in Washington state. And up there, policymakers agreed that sweeps had consequences, but they weren't really sure what to do about it.
We know that this is not nice. We know that it doesn't solve the problem, but what else is there? This question of if not this, then what was a real one.
Marc cleared several large encampments in the Seattle area, and they distilled that experience down into 36 pages, complete with flowcharts, tables, and protocols. A bureaucrat's dream.
Ryan. No 36 pages, right? We do not have enough time for the flowcharts.
Fair enough, Dan. I hear you. Luckily for us, Marc boiled it down for me to 4 basic steps. First, make a list of everyone in the encampment.
I need to know everyone who lives there, what their needs are, and what motivates them.
Things like how many people have a serious mental illness, how many need addiction treatment, who has a job that they need to be close to. Step 2, match people with the right housing. Marc says ideally that's something permanent. But as we know, Dan, low-income housing is pretty tough to come by. And few places have mental health services or social services attached. So lots of cities are converting old motels into temporary housing units where people can get access to some of those services before something more permanent opens up.
Got it. And what about step 3?
So step 3 is moving day, or as Marc says, moving days.
The important thing is don't try to move everyone out at once. Maybe every day you want to move 5 people, or maybe Monday through Thursday you do 5 people, and then Fridays you do one very complicated case.
Finally, Dan, once everyone's moved out, the last step, prevent the space from becoming an encampment again. Cities often do this by, standing up fences with barbed wire, but Marc says there's room for creativity here.
I worked with one landowner who was well, maybe we can turn this area into a skate park. It's super cool, right? That's great. That's great for the community. And the kids will love it. But a skate park is also not a place where people are going to set up tents.
So to just recap here, Ryan, step 1, assess people's health and social needs. Step 2, find housing that matches those needs, or at least get people indoors and direct services their way. Step 3, move a few people at a time to minimize disruption and chaos. Last step, prevent the spot from becoming an encampment again.
You've got it, Dan.
And absent any research on this, Ryan, what's the theory why this approach could be better for people's health?
The basic idea that I got from talking to Marc and others is that a more tailored human approach here is more likely to actually get someone off the street. You learn what folks need. For example, do they have a partner or a pet? Because if they do, offering them a bed in a shelter probably won't work.
But a private room in an old hotel might be a good fit.
Exactly. And instead of having, just a few hours notice, people actually have time to prepare. So they're more likely to organize their stuff like medications, IDs, and hopefully they're less likely to feel dehumanized like Jazmine Mapes did.
Ryan, I'm curious, how often are cities following this playbook or playbooks like this?
So Marc flagged Houston, Denver, and Los Angeles County as good examples. And I talked to policymakers in 4 California cities and counties, LA, San Jose, Berkeley, and Santa Cruz, that all have policies that are roughly in line with what Marc has laid out. They all do outreach and encampments. They pay for motel rooms. The tricky part, though, is that this approach takes time, Dan, weeks, sometimes months. And there are people living around these encampments. They often have reasonable concerns about wanting things to happen more quickly. Peter Radu, who oversees Berkeley's homeless response, says that puts cities like his in a really tough spot.
As we work towards the longer-term solutions of building more housing, we find ourselves with crisis management, which is really trying to, I hate to say it, oftentimes choosing the least bad amongst terrible options.
Choosing the least bad among terrible options.
Yeah. Peter told me about an encampment in Berkeley's most popular park that cropped up about a year ago. Peter got calls from neighbors to clear it almost immediately, but they held off.
We tried to do, assessments and get people connected to services.
In the meantime, the encampment kept growing, as did neighbors' frustrations. Then a homeless person groped a high schooler near the park.
There was a town hall meeting. I think 200 people came out to voice their concerns about this encampment.
Peter knew most of his resources were already earmarked to close a different encampment across town, and it would take weeks, if not longer, to help the 20-odd people living in this park.
We had to make the unfortunate decision that we didn't have that luxury.
Peter says they did the best they could, gave folks a few weeks' notice and short-term motel vouchers before they eventually swept the camp.
We knew that that was a Band-Aid, that once those motel stays were up, folks were going to be back out on the streets, and in fact, they were.
Peter told me that no one in Berkeley was really happy with this compromise, Dan. Neighbors felt their park had been taken away from them for months, and those 20 people, they were no closer to finding permanent housing.
It sounds like the bottom line is cities have limited resources, and unless there are more housing options, even the best intentions will often only lead to Band-Aids like this.
I think that's right. And most people I talk to, Dan, think resources are only going to get tighter. The Trump administration is cutting billions in federal funding for permanent housing at the same time that many cities and counties are facing their own budget shortfalls.
How much do these programs cost, since you bring that up?
Well, for a couple of examples, Dan, Los Angeles County spent $166 million on this over the last 2 years. The city of LA spent another $320 million over the last 3 years. Now, research has consistently shown that housing people is more cost-effective than caring for them in jails or in emergency rooms. But these programs are definitely feeling the squeeze in this moment of belt-tightening.
One other question I want to ask you, Ryan, that I've been thinking about as we've been reporting on this issue. As we've said, living outside is bad for people's health too, right? So how do officials weigh the harm that comes from leaving someone in an encampment versus the disruption that comes from a sweep?
So several people brought this up, including San Jose Mayor Matt Mahan.
We have to measure and understand the health impacts of allowing encampments to grow and persist, as well as the health impacts of moving people. We find that the longer a given encampment persists, the more likely we are to have serious issues of public health and public safety.
Rodent infestations, infectious disease outbreaks, these are the kinds of reasons, Dan, that cities will often decide to move more quickly to close an encampment. Basically, they're making the call that those are more serious health risks to the people living there and to others in the neighborhood than the potential harm of forcing someone to move.
So let's tie all this together, Ryan. We've got research that shows that kicking someone out of an encampment without giving them a place to stay can hurt their health. We have some best practices on how cities and counties can try to avoid those health harms or at least minimize them. But we also have political and financial realities that make things tough. If I'm a city manager, right, in Dubuque, Iowa, or a city council member in Tulsa, Oklahoma, whatever, what's the bottom line from all your reporting?
Your question, Dan, makes me think of Marc, who put together one of these best practice guides. Marc said they did that because well-meaning public officials would say, I know sweeps are bad, but what's the alternative? Are these best practices perfect? No. Will they magically create all the housing we need to get people off the street and into better health? No. But they show policymakers that there are ways to increase the chances that people can hold on to their wheelchair, maybe reduce the trauma that comes from clearing an encampment. At a minimum, Dan, it provides a path to treat people with a bit more dignity.
Ryan Levy, thanks for your reporting.
My pleasure, Dan.
Jazmine Mapes got lucky. That cold, wet November day back in 2023, a friend from the encampment that had just gotten cleared came looking for her.
She looked under one of the stalls and she had said that she had seen my feet. So she crawled under to see if I was okay. And I was on the toilet leaning against the wall.
Jazmine's friend stuck her fingers down Jazmine's throat, helped her cough up the bottle of pills she'd swallowed. Jazmine stayed with her friend in a tent a few blocks from their old encampment. A few days later, city workers showed up. Instead of an order to clear out, it was an offer to move in.
And I was like, I'm tired of being out in the streets, tired of waking up and finding people I didn't even know in my tent. And so when they offered housing, I said, okay, let's do this.
That offer came from Inside Safe, a city-run program. Since launching 3 years ago, Inside Safe has moved nearly 3,000 people into permanent or temporary housing. Jazmine is hoping something permanent opens up soon. Until then, she and her 11-month-old son Noah are in a motel near Dodger Stadium. You can hear relief in her voice.
Before coming into Inside Safe, I was just existing. I wasn't living. Every day I would be surprised that I was waking up another day.
Jazmine's honest about it. Moving inside has come with its own challenges, flare-ups of her anxiety and depression. She knows lots of people who have come in through the program only to end up back on the streets. But for Jazmine, she's managed, raising her son, not worrying that someone will tell her to move along. I'm Dan Gorenstein. This is Tradeoffs. Economist Amy Finkelstein has studied America's health insurance system for more than 20 years. She now believes it is finally time to tear the whole thing down.
In some sense, I think the worst and the best thing you could say about our book is, duh.
How Amy reached this turning point and her surprisingly simple solution to our incredibly complicated health insurance problems. Next time on Tradeoffs.
If you enjoyed today's episode of Tradeoffs, don't keep it to yourself. Tell someone else about it. Friend, colleague, family member. Better still, leave a rating or a review wherever you subscribe to us. The NPR app, Apple Podcasts, Spotify, wherever. The Tradeoffs team is producer Melanie Evans, senior producer Leslie Walker, editor Deborah Franklin, managing editor Ryan Levy, executive director Jessica Silverman, marketing director Catherine Dougal, sound designer Andrew Perella, chief operations officer Colleen Scheck, with help from Kate Seepy, Cedric Wilson, and Haley Lerner. The executive editor is Dan Gorenstein. The Tradeoffs theme song was composed by Ty Sitterman, with additional music this episode from Blue Dot Sessions and Epidemic Sound. Tradeoffs reporting for this story was supported in part by the California Healthcare Foundation and the Sozoze Foundation. Additional thanks to Kimberly Barnett, Ricky Blusenthal, Lisette Carmona, Jennifer Carroll, Katya Kanap, Brett Feldman, Ryan Finnegan, Nicole Fiore, Jesse Goldshear, Laura Hamilton, Jack Hinton, Lily Hudson, Keith Humphreys, Devora Keller, Anita Kidani, Clara Krager, Margot Cashel, Lena Miller, T.K. Monzone, Francisco Munoz, Robert Ratner, Eric Rafle-Yuan, Kim Roberts, Jonathan Russell, Caitlin Schwan, Michelle Schneiderman, Alex Fisotsky, Dakshika Wikrama, Heather, Michelle, Monique, and Vanessa. Thanks also to all our listeners who helped to support our work, including Katrina Boubier, Lisa Mayer, Harold and Veronica Pollock, Patrick Cunningham, and Marc Peffley. Our media partner is Side Effects Public Media based at WFYI. Tradeoffs is supported by the Robert Wood Johnson Foundation, Arnold Ventures, the Gordon and Betty Moore Foundation, the Sozoze Foundation, Just Trust, West Health, the California Healthcare Foundation, the Foundation for Opioid Response Efforts, and the Leonard Davis Institute at the University of Pennsylvania. Our financial supporters are not involved in any decisions about our journalism. The views expressed in this episode are those of the individuals and not those of Tradeoffs staff, advisors, or funders.